I'm Caitlin, and I'm going to be doing a head, eyes, ears, nose, and throat assessment today. How are you?
Good.
Good, great. Okay, so I'm going to start by just assessing the symmetry of your face, okay? Your face looks symmetrical in shape and size. I'm looking at the skin, making sure that there's no lesions, no lumps. Your skin is intact and clear, which looks good. I'm now going to look through some pieces of your hair, okay? I'm just assessing for any possible nits, any lesions. The hair distribution is even throughout. I don't see any lumps, I don't see any lesions. Your scalp looks intact. I'm going to do, just palpate this and just tell me if you feel any tenderness. No? No? Okay, and I don't feel any lumps noted. Okay, so now I'm going to come down your face. I'm going to go ahead and palpate your temporal artery, okay? I don't feel any thickening and no hardening. Do you have any tenderness there?
No.
No? Great, okay. I'm going to come down to your eyes. I'm looking at the distribution in your eyebrow hair and your eyelashes. The distribution is even throughout on your eyebrows, and your eyelashes, the distribution of hair is even as well. They curl upwards and outwards on the top and downwards on the bottom like they're supposed to. If you would close your eyes, just looking at your eyelids, and skin is intact and there's no redness and no swelling. All right, you can open. Now I'm going to just lift up right here and look just on the inner part of your eyelid, and there's no swelling there. So now I am going to assess your pupils. Right now your pupils are equal and round in shape and size on both pupils. I'm going to assess them with a light. I'm going to start with your right pupil, so you just look straight ahead for me, okay? Alright, there's brisk pupil constriction bilaterally on both eyes. Alright, I'm going to check your direct light reflex now, so you just stay looking ahead for me. Alright, right pupil constricted and left pupil constricted. So the right pupil is directly constricts, and your left pupil consensually constricts with that. Alright, so now I'm just going to move down, and I'm looking at your nose. I'm looking at the symmetry and the shape and size of your nose. There's no color variations. It is the same throughout your face. There is, your nose is midline with your face. I just want to check the patency of your nose, so if you would just occlude one of your nostrils for me, breathe in and out. Okay, and do the other. Great, so there's no occlusions there. If you would just tilt your head back just a little bit and let me look on the inside. Okay, the septum is not deviated. Stop. And the inside of your nose is moist and smooth. Okay, so now I am going to palpate your frontal sinuses. So tell me if you have any pain when I do this. No? Okay. And then your maxillary sinuses? No. Great. Okay. I'm going to look at your ears now. Alright, I'm looking for symmetry in your ears in the size and the shape, and they are symmetrical in both. I don't feel any lumps. There's no hardening. I don't see any lesions. The skin color is the same throughout, and is the same as your face color. I'm going to look just in the external canal right here to see if there is any drainage. No drainage is noted. Okay. I'm going to push right here on your tragus. Just tell me if you feel any pain with this. No? Great. Alright, and tell me if you feel any pain here. No? Great. Alright, we're going to do a little hearing test. When I ask you to, if you would just place one hand over your ear and turn away from me. Whenever you hear me whisper, whatever word I whisper, if you would just repeat after me. Okay? Alright, turn away. There you go.
99.
Very good. Great. Okay, so now we're going to move down to your mouth. I'm going to put my palpate right here, and if you would just, on your TMJ joint, and if you would just open and close your mouth for me. Very good. Any pain or tenderness? Nope, and I didn't feel any crepitus there, so that's normal. Alright, I'm just going to look at your lips. Your lips are moist, intact, the skin is intact, the color is nice and pink, which is normal. Would you smile for me? Great, your smile is also symmetrical to your face. There's no facial drooping. I'm just going to put on some gloves so that I can inspect the inside of your mouth. Alright, I'm just going to pull down your bottom lip, all right? I don't see any recession in the gums, and your inside of your lip is nice and moist and smooth. And there's no gum recession in the top either, and the lip is nice and smooth on the inside. I'm going to look at the inside of your cheek. I'm just going to take this tongue depressor, okay? All right, moist, moist, shallow, smooth. No ulcerations anywhere. All the gums are intact, and your teeth are all present. All right, would you stick your tongue out for me? Very good. I don't see any ulcerations and no lesions, and the color is a nice pink. Would you lift your tongue up for me? Very good. Okay. Your Wharton's ducts are, keep lifting. Yep, your Wharton's ducts are patent bilaterally, and your frenulum is present. Great. Close. All right, now I want you to open your mouth, stick your tongue out, and give me a prolonged ah. Very good. So your uvula rises when you do that, and is also midline. And your hard palate and your soft palate are both intact, and there's no lesions, there's no post-nasal drip, so that is good. And now I'm going, and your lips, their vermilion border has no vesicles, and which is normal, so that's a good thing. So now I'm going to move down to your neck. I'm going to do some range of motion with you, okay? So if you would turn your head from side to side. Great. All right, your right shoulder to your right ear, left shoulder to left ear, your chin to your sternum, and then if you would hyperextend your neck. Great. Is there any pain in any of that? No? Okay. So I'm just going to assess your neck for symmetry. Looks symmetrical from here. I'm going to assess your trachea for symmetry, no deviation. There's no deviation here. I'm just going to kind of move it from side to side. Okay, great. Would you swallow for me? Okay. I'm now looking at your thyroid gland. I don't see any swelling from here, so it shouldn't be present, but sometimes it is, but I don't see any swelling. I'm just going to palpate right here. I don't feel anything. Would you swallow for me again? Great. I don't feel any swelling or anything when you swallow, so nothing is noted there. And now I'm going to palpate your lymph nodes, okay? So, if I feel anything that's tender, you let me know. And I don't feel any lymph nodes are not palpable to me. Did you have any tenderness? No? Okay. And that concludes our assessment.